Good afternoon, Doctor. I'm Malini Rajgopalan, Vice President of Marketing at OneCell.ai. And actually, we would like to thank you very much for your time here today. I have a few questions. It'll be just a short, brief for us to get to know you. So, if you could please first share your name and affiliation.
Myself, Dr. Mukesh Bansal. I'm a consultant medical oncologist at Alchemist Hospital, Panchkula, Chandigarh, Tri-City.
Okay, great. My first question to you is, could you share with us your journey from kind of how you went to do your MD, kind of a little bit about yourself?
So I did my basic MBBS from Amritsar, Government Medical College, and then I did my MD in internal medicine. And at that point of time, I think I had not much idea about medical oncology and clinical oncology, but then I got to do my senior residency and a little bit peripheral work. Then I came to realize the importance of oncology, and that really excited me. And then I went to do doctorate in medical oncology from National Board, and now I'm practicing
Okay,
at Alchemist.
wonderful. In your experience, working as a medical oncologist, is there any special one case of a patient case or anything that comes to mind that you would like to share with us to say how you work through it and just briefly
Yeah, it's
share
it's
that?
it's difficult right now to remember one case, but I can just tell you if it is okay. That precision oncology, I think, is a paradigm shift right now. I will just give you an example. First, we were using chemotherapy to kill both the good cells and bad cells. Then came the targeted therapies, which were killing only the mostly the bad cells. But we were treating both the good diseases and bad diseases. Now, with the AI and precision, we are identifying which good diseases we have to spare and which bad diseases we have to kill.
Sure.
So I think, like chemo to the targeted era, this is again a very paradigm shift in the treatment, and it will spare the unnecessary wasteful expenditure and spare the patient of side effects, and will be better able to solve the problems in medical oncology.
That's great. That's wonderful to hear because part of what we do and what the world is doing right now is the change, paradigm shift change. So I want to ask you, how do you feel the technology, in general, technology has changed? And I think part of your previous question, you answered some of that. How has technology changed it? And how do you think the technology will change your way of how you treat patients going forward? And kind of if it relates to what we do.
Okay. So to talk about technology in general, I think it is changing the treatment landscape. Like now with the technology, with this precision and AI, like I just mentioned, we are getting better reports. And if I talk about in general, we are getting teleconsultations, which is due to COVID epidemic approved by Government of India also. So patients, as you know, there are really dearth of medical oncologists right now in India. So patients from far-flung areas can use this telemedicine facility, these newer apps, and even WhatsApp. So I think it is every last mile is getting connected, especially in medical field in oncology.
That's wonderful. So, do you think there's a better future for the patients that you can not use chemotherapy when they don't need to use chemotherapy and be more targeted so they will get better very faster with informed decisions? So that's wonderful. Any last words as far as how you feel like, how your interaction has been with one cell?
I think I recently heard about one cell. It looks exciting. The lectures today look exciting and promising. So I'm keen to learn more in today's event, and I think it will be give us better weapons in our armamentarium in to fight the cancer.
Excellent. Thank you so much, Doctor.
Thank you.
Pleasure to meet you.